Hello and welcome to week 7 of medical terminology class. How exciting. This actually almost halfway point. It's a 16-week class, so we're almost there and you can make it. And here we are talking about the lymphatic system today. How exciting is that? Okay. Now, you may not know off the top of your head what the lymphatic system includes. And of course, we're going to go through that. But you have heard references to parts of this, I'm sure, is on television and in the movies. They might refer to a patient who has cancer or malignancy, okay, that has spread to the lymph nodes. That's part of the lymphatic system. Okay. And you might have seen on Chicago Med or Grey's Anatomy, a patient who's been in a car accident and had their spleen damaged and has to be removed. That's also, the spleen is also a part of the lymphatic system. So it's not as strange as you might initially think. But let's talk about what it is and what it does. So the lymphatic system, as you can see, is present throughout the entire body. And basically, the lymph, which is kind of like a fluid of the lymphatic system, goes through the body to its stations, which are lymph nodes, to enhance and act as the immune system's soldiers. Okay, so what does that mean exactly? That means that the lymph that flows through and passes through, fills up these nodes, strengthens their ability to fight off the enemy, which are pathogens, right? Bacteria, virus, fungus, all kinds of stuff that can get into the body and harm the body. So these nodes, you can understand that if any of these nodes became or adopted malignant cells, that could very well and easily spread throughout the body. Look at all these green lines on the diagram that you see. Okay, so as you can see, it starts. Well, we always refer to the body from head to feet. Okay, so we start with the cervical lymph nodes, which, remember when we talked about the musculoskeletal system, particularly the skeletal system, those first 5 vertebrae in the spine, including the C1, which attaches the spine to the brain, right? There are cervical lymph nodes right there. Okay, so right at the edge where the brain attaches. Then next you have the palatine tonsil that's in your throat. You've heard of tonsillectomies. Well, the tonsils are part of the lymphatic system, and that is part of their job is to fight off problems that may come in through the oral cavity or the nasal cavity that goes back down your throat. Okay. So that's one of the reasons why pediatricians may be hesitant to remove tonsils and try to reduce the inflammation first, is because they are an important part of the guarding of the immune system. But if they have to remove them, it's not a big problem. Okay, there are other ways to keep the immune system strong. And you certainly, like we talked about with the malignant cells, we certainly do not want infection cells, inflammation, to then come through and travel through the body system, right? Of course, right. Okay, next is the thymus. We're going to talk about that in a few minutes. You have your ancillary lymph nodes, ancillary meaning the armpit, what we know, those are major clusters of lymph nodes. Then the spleen that we talked about before, and you can see where it's located. It can, at times, with the right impact, be damaged, whether it's in boxing or a car accident or something like that. Okay. You have your right lymphatic duct. Now remember that right left is always the patient's right, not your right, looking at the patient. Okay. We then have the thoracic duct. So the thoracic duct is located where? In the thoracic cavity, of course. So at least you can see how these terms that you're learning all engage each other. They all help each other. They all support each other, right? We have the cervical vertebrae and the cervical lymph nodes. Now you have the thoracic duct in the thoracic cavity. You see how it all works together with regard to location and sometimes function. Cisterna chyli, I may not be pronouncing that correctly. And then the inguinal lymph nodes, which are, remember, your inguinal area is your groin. Okay. So you may have heard somebody having an inguinal hernia. That's between the muscles and the large intestine. But in that same area, the inguinal lymph nodes are there to help protect. And as you can see, continue on down the legs to protect. Okay. All right. Now, the lymphatic network, which you were just looking through. Okay. But now we're going to look at the lymph node. This is a lymph node close up. Isn't it pretty? It kind of looks like a pomegranate. Well, all right, without the little bead things. All right. So the cervical lymph nodes, we just talked about that, the cervical spine neck area. Thoracic lymph nodes in the center of the torso, which is the thoracic cavity. The ancillary lymph nodes in the armpits. You have the supratrochlear lymph nodes in your elbows. Wow, in your elbows. Okay. Abdominal lymph nodes, the mesenteric, which is the lining of your abdomen, and your lumbar. Remember, the lumbar vertebrae of your spine are right at your waist. Then you have your iliac lymph nodes, which are those present in the pelvic area. Remember, we talked about that. The inguinal lymph nodes in the groin, and then the popliteal lymph nodes that are throughout the lower extremities, i.e. your legs. Okay? So you can see here how blood flows into and out of the lymph node. You see the artery and the vein, the red and the yellow. Remember, even though in all illustrations the veins are in blue, the blood is still red. Okay, everybody has red blood. Okay, even the blue bloods. Friday night, 10 p.m. Eastern Time. It's a good show. Okay, but that's not the same thing. You know that. Okay. And then you have incoming and outgoing, I should say the other way, incoming and outgoing lymph vessels. So you see at the bottom center of this illustration is the incoming lymph vessel. So the lymph now is flowing through the whole body and it's coming into the lymph node. Okay. And then the lymph node is like a filter. And then that is going to then now it will continue on the lymph fluid. Okay. And you see here what is going on in this little blue box as the fluid enters the lymphatic capillary. Remember, capillaries are small veins and arteries. okay? And then it comes into the valve, opens up and says, come on in. Similar, remember we talked about how the blood flows through the heart and how it comes into the atrium. And then when it's ready, the valves open and the blood flows from the atrium to the ventricle, right? Remember that? And then the valve closes, so no more. And then when the blood is ready, the valve opens to go from the ventricle into the arteries. So it's the same mechanical process of the lymph flowing through the body and coming in through all of these little filters, the lymph nodes. Does that make sense? Good. Okay. All right, the thymus, remember we talked about that before, and that's up here. Up here, it's below your thyroid, which is pretty much right here. Okay, don't choke yourself. Okay, and then it comes down here. That's wrapped around the trachea as it nears the lungs. So it's right there at the base or the top of the base of the tree. Remember when we went through the lungs and the trachea leads into the bronchioles and the bronchioles to bring in the oxygen? It kind of looks like an upside down tree. So that's great. So that's where the thymus is located, right there. And it's also part of the endocrine system. So again, you can see here how the thymus, in connection with the thyroid, the endocrine system is working with the lymphatic system to make sure the hormones are producing at the right levels, and again also to provide those immunity defenses to ward against disease. Okay, so now you can see how, again, this is why you have so many terms in your medical dictionary, in your list of terms to learn, and why it's important that you use your medical dictionary. And remember that sometimes one word can refer to two different things, or one word can refer to two different functions of the same organ. You have to be flexible. But remember, you have that medical dictionary to make sure that you're remembering accurately. That's most important. Okay. I don't know. It's, technology. What can we do? All right. Back to the spleen. The spleen is, as we mentioned before, it's right over there on the left side of the patient. Okay. That 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 part that looks like almost like a rounded triangle, that's your liver. Okay. And the blue in the illustration is where your spleen is located. And just like the lymph nodes, this is a larger filter for the attack against infectious organisms, the pathogens, and also to clean debris out of the blood cells and the red pulp, which is part of the blood. So you can see here in the little inset how there are these filter parts that are part of the spleen. As the artery blood comes in, goes through the spleen, and then comes back out via the vein. Okay. Isn't this amazing? The human body is absolutely amazing. Now, you remember we talked before a little bit about the palatine tonsils, the tonsils and the adenoids in the back of your throat, in the in the back of your oral cavity, right where it ends at the throat and makes that turn downward, okay? These are part of the digestive system, and also they are little lymphatic pieces of tissue. They also, just like the lymph nodes, trap pathogens, bacteria and viruses, and pass them into the tonsillar lymph nodes to be eliminated. Get rid of the enemy, okay? So as I mentioned before, they are an important part of the human body's army against illness, bacteria, viruses, fungi, all that stuff that makes you sick. Okay, so I thought maybe we would take a look at a case study of a patient, and this might be what you would see in the physician documentation. So you would know, depending upon what job you move toward. So if you're the nurse or the medical assistant, you would do one thing with this information. And if you're the coder, medical records professional, you would do another thing with this information. So I'll just read it to you and then we can discuss it, okay? A 4-year-old female was brought in by her father with complaints of acute malaise, shivering, and vague pains in her legs of 24-hour duration. Father states that over the last 12 hours, she had vomited twice and complained of a dry, sore throat. Physical examination revealed she is febrile, meaning she has a fever. Tachycardic, which means her heart is racing. Tender, bilateral, both sides, cervical in the back of the neck, lymphadenopathy. Lymphopathy, remember that suffix means illness is present, not functioning properly. The pharynx, tonsils, and buccal mucosa, buccal inside the cheek, are red and inflamed, and her tonsils are studded with white areas of exudate. A throat swab taken before starting antibiotics grew beta hemolytic streptococci group A. Streptococci. You've heard of the streptococcus bacteria. Diagnosis of acute bacterial tonsillitis is confirmed. So now we know antibiotics is correct. Anti meaning against, biotics meaning bacterial. If she had been infected by a virus, antibiotics won't work. You need an antiviral, okay? Malaise, that's just that, just incredible weakness throughout the body, not wanting to do anything. I'm sure you've all enjoyed that at some point in your life. And by enjoyed, I don't mean to enjoy. Okay. All right. We know she had a fever. Her heart was racing. She had cervical lymphadenopathy. I love these medical terms. Okay. And the exudate are little white areas filled with pathogens, okay? The swab required before anything could go further because you got to do the lab test. And now we know what the patient has. We can know exactly how to care for this little 4-year-old and get her back out into the playground ASAP. Okay. Any questions? All right, then. You know what I always tell you, seriously, review these words and their meanings often. Use your medical dictionary so you are learning accurately, not kind of sort of what somebody remembers it might mean, okay? And query me whenever necessary. Whenever you have a question, you want a clarification, you want an explanation to better understand, email me. I love it when students ask questions. You know that. And I am here every single day, 7 days a week, to email you back within 24 hours. We can always have a one-on-one appointment, phone, or a personal Zoom, whatever helps you learn, okay? This is the foundation of all healthcare. So no matter what your path is going to take, clinical side, administrative side, you must understand the language of your industry. Okay, you all have a great day. I will post this recording and be safe.